You may remember this story, a trip across the border in early March. It turned tragic for several Americans. The group was seeking affordable plastic surgery at the time. What we found was that your physical safety is not the only consideration before you book an appointment abroad. Four Americans just over the U.S.-Mexico border looking for more affordable plastic surgery options at a clinic in Matamoros. Two of them kidnapped and killed on March 3rd. The other two finally released. But before it was over, there were calls from Washington, D.C. to send in the U.S. military to intervene.
We're going to unleash the fury and might of the United States against these cartels.
Finally, the Gulf drug cartel confessed, even apologizing, admitting the Americans were confused for rival gang members.
It's a brand new laser. There's only two in the United States.
The people that went to Mexico, they were going to get a gastric sleeve as well as some cosmetic surgery, and we're talking again a savings of $3,000 to $4,000. So yes, that's important for somebody, but I mean, so's your life.
Dr. Harry Bafidas is a board-certified general and plastic surgeon practicing for more than 30 years in South Florida.
It's uncanny how somebody would put their face and body on the line to save $2,000 to $5,000. And, you know, that makes no sense.
Even so, Dr. Bafidas sees several cases every quarter. Bad outcomes, he says, from botched procedures abroad.
Well, I've seen everything ranging for poor dentistry, where they have to get implants and have their teeth pulled out because of gum disease. And I've also seen terrible scars, chronic boils, and infection that continue to fester. We're talking a year or two later. And then asymmetry, that one side is different from another side, be it a breast, or a collapsed nose.
But in spite of those outcomes, medical tourism doesn't seem to be going away. In early 2020, Americans could, on average, save 40 to 60% by having major surgery done in Mexico. Those numbers, according to consumer watchdog group Patients Beyond Borders.
At the end of the day, you're going down there and you're placing your own health and welfare in someone else's hands. It may not be a bad idea to maybe do a little investigation.
Dr. Josh Lynchus is president of the Florida Medical Association and the chief medical officer for Broward Health.
Number one would be to check the Department of State website and identify, make sure the country is okay. Number two would be the institution. If it's going to take place within an institution, and most surgeries take place in some kind of ambulatory surgical center or within a hospital, is to check out that hospital. Make sure that it has some element of accreditation that meets similar standards, if not exceed the standards that we have in the United States. And then third would be the person actually performing the procedure. Nowadays, the word doctor does not mean a medical doctor or an osteopathic physician.
Doctors Lynchus and Bafidas both recommend checking the physician's credentials, suggesting medical education and practice requirements are not universal.
They don't have our standards. In fact, they all say that we have the most rigorous standards for medical training.
A reminder to patients looking for a deal over the border that the U.S.-trained standard matters.
In America, there is a consumer portal for board certification in the United States. Just because a physician practices in another country doesn't mean that they didn't have perhaps training in the States or even be board certified in the United States.
So if you are moving forward with medical care of any kind abroad, do your homework. Dr. Lynchus actually suggests emailing the physician directly to check and see where your practitioner received their training. A lot of foreign physicians do come here to the United States because of those rigorous medical education standards we mentioned in our piece. There are a number of certifying bodies: the American Board of Medical Specialties, the American Board of Surgery, and the American Osteopathic Association, just a few. Every one of those groups has its own website. You can search and confirm board certification of a physician here in this country.